Now, for the next disease which we'll be linking to heart failure is over-transfusion of fluids or blood. So, if I'm transfusing too much fluid to the body of a child or too much blood to a body of a child, is this enough reason to actually cause heart failure in that child? So, that's what we're trying to actually talk and actually establish a link between the two. Now, for me, if I see this kind of thing, I'll be suspecting that, okay, maybe there was now too much volume for the heart to deal with. Do you understand? So the heart was kind of like overworking itself. That's what actually led to the failure, So, over-transfusion, whether it is with fluid or blood, it can actually overwhelm the child's cardiovascular system. So this can actually lead to what? Heart failure, especially in vulnerable populations. That's all those neonates and children. So they have an existing cardiac issue. This leads to what? Complications more, right? So mechanisms, how this over-transfusion could actually trigger heart failure is volume overload. So excess fluid or blood increases the total circulating volume, okay? So the heart is now struggling to deal with too much fluid buildup. Do you understand? So this can result to pulmonary edema and congestive heart failure, okay? So next, transfusion-associated circulatory overload, that's TACO. Right, this is a recognized complication of what? You giving blood too rapid or you giving too much blood than the person is needing. Do you understand? So symptoms like respiratory distress, hypertension, pulmonary congestions, all of this could actually come up. So children, especially infants, are at a high risk due to smaller blood volume and immature cardiac function. So electrolyte imbalance stage 2, so hyperkalemia, so high potassium from stored blood can cause arrhythmias. That's like when you store the blood in a blood bank before giving it to a patient, potassium levels are so high, okay? So this could actually contribute, and of course children are still on coming up, you understand? Then calcium levels in stored blood usually decreases, okay? So this can actually impair cardiac contractility. Yes. So increase after load. So rapid transfusion can raise systemic vascular resistance. So the heart is working very hard to eject blood. So this would actually, contribute faster to a heart failure in children. All right, children mostly because they are vulnerable. They are still coming up and all of that. Okay, so that's how over transfusion with blood or fluids can actually contribute to these heart failure issues in children.